Hi, folks. Now and family. This is Jim Marshall from the Now and Training Institute, and I'm glad to be back with you folks. This is episode 2 of our little series here that we're calling the Sustaining Now and Resilience During the COVID-19 Pandemic. And we're offering you these little mini lessons to support you as you're facing the psychological train, trying to walk on the psychological train of COVID-19. And in this unit, we want to be able to look at two things. It's about making firm choices. First of all, about the information about COVID-19 that you bring into your brain. Like, what are your news sources? Where are you getting your information? And secondly, what emotional code are you traveling with? How are you carrying the emotion of all of this as you go? So let's take this first choice and the issue number 1 here. We're going to all feel better if we know that the information we're putting in our heads and in our minds, our bodies is legitimate, is accurate about COVID-19. Because there's an old proverb that says, as a person thinks in his or her heart, so are we. In other words, it's kind of like food. What we eat for breakfast ends up being what carries us through the day, right? Nutrition, lack of nutrition. Likewise, the kind of information that we put in our brains, what we tell ourselves, ends up impacting our mental health and our physical health and how we roll with our relationships. So it's really, really important that we choose credible sources of information, and the amount of even accurate information that we gather and take in here has to be managed, right? I just want to recommend that for information about COVID-19, that you use the Center for Disease Control, the CDC's website. Get your information there. Be selective about what news sources you're going to listen to or watch, and then limit the amount of time so that what you have is enough of the right information. 911 pros, you guys already have enough problem with sleep, right? I've done my informal little survey all over the country, and I can tell you it's between 4 to 6 hours the dispatchers get per 24. Not near enough as it is. Then there's the issue of how much quality sleep are you getting during those hours when you're trying to sleep, right? The more data bits you have that are full of anxiety, the more it's waking you up, the more you're activating stress hormones. You don't want that. So we want to face the reality of COVID-19 without sensationalizing, without catastrophizing, right? So that's my first point for you. Please choose your sources wisely and dose it, okay? Number 2, what is your emotional code? What do you believe you should do with emotion? So when we lose people in our life, do we grieve? How do we grieve? Do we allow ourselves to feel the sorrow, the loss? That's not easy to do. And if I don't know what to do with my emotion, I'm apt to just suck it up. And does that sound familiar to you? Most of our emergency responders learn to just suck up emotion and keep going. And I get it. They didn't know what else to do. But the fact is, the more we pack in difficult, negative, be full of some hope and some encouragement. And that's the goal of this series in terms of sustaining your resilience as now professionals through COVID-19. So what I want to recommend to you is choose an emotional code that will truly work for your life. What do I mean by that? Emotional code means what you believe you should do with your heart, with your emotions, as you travel through difficult things, right? I want to suggest that you look for someone in your life who you feel you can be vulnerable enough with, whether you're a 911 leader or you're one of the leaders in our country, or whether you're a frontline dispatcher who's carrying the daily weight of this from the public. Whoever you are, we each need someone that we can open our heart to and be honest. Now, this might sound simple and a little bit too warm and fuzzy for you, but the fact is, our struggles with PTSD in the 911 industry are partly driven by not knowing that it's okay to really express pain as we feel it. So there you are, you guys, Unit 2. Choose your media sources carefully, but also choose an emotional code that allows you to seek out and receive support. Be honest, be open, be vulnerable with at least somebody in terms of the vulnerable feelings that you have related to this, because you're going to have them if you don't already. So peace to you guys. Take care. Let me hear from you. info@911training.net is the email that you can send questions, ideas, suggestions to, and we'll be looking for those. Partner with us so that we can customize the rest of these episodes and make them the best they can be for you. Thanks. Talk to you soon.